My name is Alexis Davis. I'm the social media manager here at RSDSA. I'm joined by Jim Broach, Executive Vice President and Director of RSDSA, and our first session speaker this evening, Emily Deneault, and her patient, Paul. Emily is American Bowen Academy certified with the highest credentials. To reach this level of recognition, she succeeded through all the levels of the Bowen Advanced Procedure modules. She's the only practitioner in Massachusetts to have this level of training. Along the way, she has been guided by her Bowen mentor, a naturopathic physician who has practiced for over 30 years. Furthermore, Emily is a certified corrective exercise specialist. Using this training, she often gives stretches and exercises to help undo and change old postural patterns. A longtime follower of alternative approaches to medicine and healthcare, she continues to study, learn, and grow in her career. Emily graduated from the University of Massachusetts Dartmouth with a Bachelor of Science in Medical Laboratory Science. She has worked as an EMT, a lead laboratory technician in various hospital settings, and a professor at UMASS Dartmouth. She is genuinely committed to helping, healing, and teaching. And as always, everyone, remember that while the information shared here is helpful, please consult your physician for personalized medical advice. And also be sure to leave comments and questions in the chat for Emily throughout her discussion. Jim, any comments before we pass the stage over?
Thanks, Lex. I just want to say last night we sold one hat, and I'm looking forward to selling more, white or orange. November is our National Awareness Month. Orange hat's great. Well, it wears well. I also want to say that Alexis put together a fabulous newsletter, and she'll put the link in there to get it to join us. And each month it comes free to your inbox, and that's great. And Emily, I'm so excited that you're here. Paul, thank you for giving your expertise too, and take it away.
All righty, the floor is yours.
I wanted to go through my experience with complex regional pain syndrome and how it kind of led me to Bowen method. Let me take me back 2 years ago. I had carpal tunnel in my hand. I had carpal tunnel surgery probably about 20 years ago. And I started to get mild symptoms of carpal tunnel. And I also developed a carpal boss in the back of my hand. So I was referred to a hand surgeon. When I went to the hand surgeon, he recommended that I have the carpal boss taken off the back of my hand because the tendon was flipping back and forth over my hand and it might rupture the tendon. So at the same time, he recommended I have the carpal tunnel surgery. So in the middle of the pandemic, September 2020, I had the hand surgery done, both on the back of my hand and on the front of my hand, front wrist for my carpal tunnel. So I went in and he put me in a soft cast. I came out of the surgery with a soft cast on it. I went back. He took me out of the soft cast. And when he took me out of the cast, I noticed that I had a bruise from my wrist all the way to my elbow on the inner part of my arm. So at that time, they put me into a hard cast, the fiberglass cast. And about a week into that, my arm and my hand were swelling so much that I had to have the cast taken off and a larger cast put on. So I was in the cast for probably another 2-3 weeks. He took me out of that cast. And then my next stage was to go to occupational therapy to get my hand back to working and the strength back and everything. So I started going to occupational therapy, and they noticed at that time that I had quite a bit of scar tissue, both on the back of my hand and then on the front of my hand around the wrist area. So they started working on the, reducing the scar tissue, and the other thing is with my my wrist, I couldn't bend my wrist. So they had thought that it was due to the scar tissue. So they started working on the scar tissue both on the back and on the front. And I was at a negative 15-degree angle, and my wrist was pretty much fixed at that point. So I started to work on it and work on it. And I got to about 30-degree. I still can't go any further than a 30-degree bend in my wrist. So at some point in December, the occupational therapist decided that she'd put me in this, they call it a joint activation system. Basically, what it does is it forces your wrist to bend, and then you crank it to bend it, more and more and more. After about a week of that, I started to experience a lot of different things. My first symptom that I had was, and this happened all at once after about a week of doing the jazz. I started getting a shooting pain in my wrist, similar to putting your finger in the wall socket. So that was occurring every 3 to 5 minutes. And when I lay in bed, I jump because it was so intense, the shooting pain. My heart started to race, out of control. I wasn't able to sleep much. It seemed like I was producing more and more adrenaline. I started getting pain in my shoulder. It felt like I had a knife in my shoulder blade region. Contractions, spasms in my muscle and my arms, swelling, and then my shoulder started to round forward. That's what I was noticing that. I started to get swelling in my hand and my arm. My fingers were basically twice the size that they are usually. My hand was turning cold, and it started to turn different colors: red, purple, blue color. And I also had neck pain and inability to turn my head side to side. Basically, my hand at that point started to form almost like a claw shape. I couldn't move it from a certain position, and I had trouble moving my fingers, sweating in between my fingers, so that they actually, they were swollen, and on top of that, they were stuck together, which made it even worse. So I had to, every day I'd get up and have to drain the lymph from my fingers and my hands to start to be able to move my hand. Within about a month, fibrous tissue had laid down in my fingers. So it kind of felt like pipes on my fingers. So I was actually not able to move my hand. At that time, I was still seeing my occupational therapist. And she said, and I started getting shoulder pain. She says, well, I can't do anything for your hand at this time until we fix your shoulder. Basically, if your hand doesn't work, your shoulder starts to shut down. So my shoulder started to freeze up. So I had to go to physical therapy to start working on my shoulder, get that back into working condition, and then start working on my hand. So from there, I had, at this time, I went back to my hand surgeon, contacted him. He gave me gabapentin, and he had diagnosed me with chronic pain syndrome. And he recommended that I see a pain clinic specialist. And I was able, during the pandemic, to get an appointment with the pain specialist in about 6 weeks, which seemed like a long time when you're in, pain. 6 weeks later, I went to the pain management specialist, and they recommended stellate ganglion block. He put me on 900 milligrams of gabapentin and nortriptyline. And they also gave me a lidocaine patch for my shoulder. Most of, at this time, a lot of the pain was concentrated in my shoulder blade, at the base of my shoulder blade. That's when I started to before the stellate ganglion block, I started to, I booked my appointment with Emily and started to go to Bowen. My main, when I first started in December with the symptoms, I went actually a week without sleeping. Hard to believe that I could go 1 week without sleeping, but that was, actually what happened to me. I'd walk around the house and basically not getting any sleep. I'd lay down for a little bit because basically my whole shoulder or my back was in pain. Then when I lay down, my heart would start racing. So that's when I started to, I booked my first appointment with Emily. I believe it was in January that I started with Bowen. I came in not having any sleep, and she started, doing Bowen with me at that time. My main goal was to get some sleep. So that was my main thing. I wanted, first off, I wanted to get some sleep. Second, I wanted to reduce the pain level. And then thirdly, I wanted to reduce some of the swelling in my hand, my arm, and my shoulder. So those were the three things that I think have been effective with Bowen and seeing Emily. And it's been a transition from there. I can honestly say I've been seeing Emily for almost 2 years right now. And it, gradually got better. Every time she'd do a session, I almost would have no pain, for the next, 8 hours to a day. And then, it would gradually come back. But, I believe what was happening at that time, it was my body had to slowly start to heal itself and take over and start healing. So that's basically, and then, over the 4 or 5 months of both doing Bowen and, doing exercises and physical therapy and occupational therapy, I started to, gradually, sleep from, go from 2 hours a night, 4 hours a night, 5 hours. It took me a good 5 months before I could get like 8 hours of sleep a night. But that's, with Bowen, every time I'd go to Bowen therapy, I would, have either minimal pain or no pain when I'd finish a session. So it was just amazing. And at that time, being in immense amount of pain, to get even, 8 hours of minimal to no pain, was well worth, anything that I could, pay for it. So, it's been, and then, I think that the other benefit that I saw was, Emily would work on my lymphatic system and work on my arm. And, before the end of the session, I'd see the swelling go down. She'd work on my shoulder blade, which, I would notice that my shoulder blade would pop out a little bit and I could actually feel it. At the end of the session, it would go back. Now, I don't know what was going on, and maybe there was swelling behind the shoulder blade that was popping it out, and Bowen, created, reduced the swelling. But almost on every occasion, at the end of the session, and Emily would ask, is there anything, what's your pain level now? And, I'd be without pain when I'd walk out. So it's been, amazing. And, I think, a couple of weeks ago, I said to Emily, I said, not a lot of people know about complex regional pain syndrome, and not a lot of people know about Bowen. And I said, I want to be able to get on to a session and tell my story and tell people that there are other options out there. And Bowen, for me, has worked. So I wanted to kind of turn it over to Emily so she could show you some.
Okay. Well, it's quite a story. Usually, I just want to say that, he has wonderful things to say, but, it did take a lot of time to kind of get there. I don't want people showing up being like, I want to walk out of here.
Right.
All right, let's. All right. So for many of you, you're saying I have never heard of Bowen before, and not a lot of people have. So it is a very gentle form of connective tissue therapy. And primarily, we work on the fascial network. So fascia is like the connector of all connective tissues. And the one thing I really want to hone in for those of you who don't really understand fascia is to understand kind of what it's doing, because that will come next of what I'm going to talk to about. So your fascia is everywhere. It's it connects all your muscles together. It connects, it wraps every muscle. If you think of your quadriceps, it's 4 quad, right? And they're separated. They're separated to be 4, and each one has a layer of fascia around it. It's really long, thin, strong connective tissue. And it also holds everything in place. So all your organs inside are not only wrapped in fascia, keeping them all nice and giving them the form, but there's just sheets upon sheets that, make sure if you don't move wrong, your spleen doesn't kind of fall to the side. It's all kind of packed in. The classic example of that is usually kind of talked about for fascia is an orange. So you have an orange, and, when you shake the orange, the orange isn't inside just moving around. It actually, the skin and the rind are attached to the inner orange. And then when you peel it, you kind of separate it. I don't know, what's that stuff called? The white stuff, rind? The skinny stuff. So then you peel it open. Okay, so let's say that's the first layer of the fascia. So then inside of that, you have a full orange. And then it's wrapped around the orange skin. And then you can pull it apart, and then you get segments. And each segment is wrapped with another kind of fascia, you can say. And then if you actually, pop open an orange and you see all the little pulp, that's all wrapped in its own fascia. So you can just kind of take that and, make them the organs and muscles. And, so really we're just big oranges, I guess. So again, so it's everywhere. It's wrapped, what am I missing here? Hold everything together. Oh, so it also provides lubrication for everything else to kind of move off of it. So every time you're moving and it feels okay, it's because everything inside is wrapped in fascia, and it's making everything kind of go against each other nice and smooth. Well, it should be. Healthy fascia is just kind of gliding like this. Stick and kind of stuck and fascia dehydrated, it's not going to move so much. So that's another purpose of fascia. So the keynote I'm saying right now is pretty much everything in your body is connected. So, and now I'm going to pull out that word tensegrity, right? So the classic example of that are those fancy bridges that they made a long time ago, and you want to walk up and just take out a little stone and then the whole bridge falls down. Or, the pyramid, right? If you do a pyramid, the principle of that is that each side is pressing equally on each other to hold itself up. So if you were to take away one of those sides, what's going to happen to everything else? It's going to crumble. So your body kind of works in the same way. If you think of a link chain, if you take a little chain and you kind of nick it, it's going to affect the little link on the bottom. It's going to come up a little bit. So sometimes, if people have chronic ankle pain that's been there, they keep injuring it, that can easily be causing in the future knee, hip, or even neck pain. So again, fascially, the way we think of the body is much different than certain kind of specialists. You go to a shoulder. They're going to look at your shoulder. Well, a lot of times when I work on shoulders, I'm looking at hips. So it's just a different way to kind of look at things. So now that you kind of got that, right? You got that, you're all nodding. I can't actually see anyone, so I'm going to think you're nodding. So the next thing that is really awesome, because fascia, in fact, only less than a decade ago, they actually classified it as an organ in the body. Before, it was just something that got in the way when they were operating. They would cut it open and they'd say, you know, it was just packing material. So that's huge. And ever since then, just the research is just skyrocketing every year. And with that said, the new thing that they found out is your fascia is one of, maybe even the largest, soon to be said, sensory organ in your body. So what does that mean? It means all your touch, everything, all the receptors. It's like, it's huge at sensing things. All right. And again, we just said it's everywhere. So everywhere you're just sensing stuff. And I think your brain has about 100 billion neurons in it. And they're calculating now that in an average sized human, in their fascial network, 250 billion neurons, receptors and stuff. So think of that. That's, you know, it's everywhere and it's very, you know, it's got a lot of receptors in it. It can take a lot of information in. So those are two, I think, very exciting things that, you know, are just kind of on the surface of all this, you know, exciting stuff. So, I'm saying those, I'm getting that out of the way because it's important, because when I am dealing with anyone who is suffering from chronic pain, the first thing I want to do is settle their nervous system. So this would make sense, right? Because if you're in a lot of pain, pain takes a lot of energy, right? I don't need to explain any of that, unfortunately, to everyone, because you know. So if your nervous system is using all the energy to, one, be in pain, I just had a brain fart. Hold on, let me look. So nervous system. Oh, it's stress. Stress, right. The fight or flight response. Yeah, of course, that's what I'm getting to. So if you're stuck in pain for too long, or stress, any stressful situation, which pain is, what happens? All right, you know, we're settled, and then clicks on the fight or flight response. So we've all heard of the fight or flight response, right? But do we really know about it, what it does? So it's almost like your body is in this sense of danger. It's almost like the body's emergency mode. So you actually have postural changes that take place when the fight or flight kicks in. You know, people's shoulders go up, you know, their hip flexors flex, you know, it's just kind of, you're going to run or you're going to fight. So people kind of get this posture that's what they're going to do. So if you are every day stuck in the fight or flight response and your body's like, you know, we'll get back and we'll try to heal that tomorrow. We're just trying to get through today. We're just trying to get through today. You know, brains, they learn things, they get reprogrammed. So then all of a sudden the fight or flight is normal. That's how you live. Your body's like, oh, this is just what we do now. So if you're in fight or flight and you have all that energy going to the stress response constantly, you have no extra energy to heal. So if somebody was going to come in and they had, you know, a severe something, but they, you know, a hand, a wrist, anything, but they've been suffering for a long time, or the constitution of them when they come in, you know, some people come in, like Paul came in, you could see it. I mean, it's like, they can't take it anymore. So if I go and I just say, I'm just going to work on this, everything's going to be okay, I can't think that the body's going to say, okay, let's just deal with that right now. When we haven't slept in a week, you know, I've had anxiety for 13 years, you know, it doesn't make sense. So the first thing for chronic pain, the nervous system. So that's important now, that everything I just told you about fascia, because look at that. Right under your skin, anything you kind of do in a certain way, you're affecting sensory receptors. That's exciting. So now, let's say I'm just going to demo one type of move. Actually, oh, you know what? Get up and just sit on that side so I see your back. Okay. Don't worry. Yep. I won't like make faces or anything at you.
Okay.
All right. So this is like a classic. This is how every Bowen session is started, by the way. So we call it the move, and you probably can't really see it that well. My camera that I had, it kind of just, you know, didn't work. So we have this way. This is the move right here. I'm on the erector spinae muscle right here. Very gentle. I'm just pulling back. I'm going to sink just a little bit, and then I'm just kind of roll. And this pressure I'm using right now is probably even less than eyeball pressure, which is kind of like, you know, putting pressure on your eye that you don't feel like you're stabbing yourself in the eyeball. So that's one move that I would do. And let me just, I get so excited about this. I really just got to slow myself down. So how does Bowen, how do we use it? You can turn it.
Okay. Yeah.
I was just. So how do we use Bowen to settle the nervous system? So again, we're using fascia, we're using very light movements, and we're using very little work. So that move right there, I would do one on the other side, and then I would leave. I would say, you know what? Why don't I put an input into the nervous system? All right. And we just need to see what the output's going to be. So I'll leave the room, and depending on people's body awareness, which again, with chronic pain is very interesting because a lot of people have tried so long to get away from body awareness because they don't want to be aware. They're trying to be like, I don't want to feel this anymore. And unfortunately, part of the healing process is bridging that gap between the mind and the body. So with those moves, it's almost like, honestly, it seems like nothing. And I think sometimes most people leave here and they're like, I don't understand how that possibly could have done anything. But, you know,
right.
Well, it does. So it settles it, very light moves. So you don't feel overworked. That's the number one thing. You don't want to overwork an already overstimulated nervous system. So it's hard to kind of gauge because every single person I'm going to look at differently. I'm going to assess differently. I'm going to come up with a different plan depending on how they, you know, can take things. So it's very individual and very holistic. Those are the two things that I would kind of say. So I think, you know, oh, and the output. So you put in an input, and what do you have to say about the output? What are some things that you have felt when I've left the room and kind of left you to stew?
You know, a lot of times, you know, I go into almost like a trance, not a trance, but, you know, relaxation. The other thing I'd get, you know, sometimes I'd get very, very cold. That was another, but that's basically the healing process. Your body is starting to heal. You start to get really, really cold. The other thing that I wanted to bring up is there was a lot of sensitivity with my hand, and because Bowen is so gentle, I was able to be able to use this method, and I adapted to it really well because you know, it's almost like I couldn't even touch my hand, but because it's so gentle, I was able to get more out of this technique than most other techniques. Even my occupational therapist, she would like, well, why are you, you know, in so much pain? You know, I'm touching your hand, and, you know, why are you like, I literally, you know, be in pain, and my head would be down on the desk, you know, like, ah. But with Bowen, you know, it's because it's such a gentle technique, you're able to tolerate it a lot better than most treatments. Yeah,
I'd have to say that's a big benefit because of how light it can be, but yet still how profound. Yeah. I just have some side notes that I couldn't fit anywhere pretty, but I think they're important for you guys to know. And interestingly enough, we're talking about the nervous system and the fight or flight. So ironically, it's not ironic actually at all. I don't know why I said that. There is an opposite to the fight or flight, and that is the parasympathetic state. And that is the opposite. So when we're in fight or flight, we're kind of like ready to go, you know, fighting, all that good stuff. The opposite, we call it rest and digest. So that is where the body can heal. So fight or flight, it's an emergency zone. You can put whatever you want into it, but it's like, can't do it right now, just trying to survive. So when we try to get people back into that parasympathetic healing, relaxing, you know, less anxiety, you can breathe better. That is when you're sleeping, you can sleep You heal when you're sleeping. So that is, to me, the most important thing, to try to get people sleeping and take down their anxiety. And a lot of times when you start to settle the nervous system down, I mean, the body is very smart, and it's trying to make things more efficient. So if all of a sudden it has a little bit more energy to do something with, it's going to find a balance on its own. You're going to just slowly start, it's going to like, you know, it's going to find hemostasis. And if you have more of a healthy balance and you're feeling more relaxed and have energy for it, you know, it's going to do it on its own. That's what it wants to do. So one of the things that I wanted to mention though about parasympathetic is, with Paul, I found this very interesting. He came for the first 2 sessions, and, you know, he did get a little relief, and then he'd come back and you could just see it all over him. And he was, I think, at that having heart palpitations, right? When you super anxious. That was the first thing I kind of noticed. Not sleeping, hadn't slept at all. And all those things are kind of like, you know, definitely, you know, fight or flight type, you know, response. So the opposite of that is parasympathetic. And you have a very fancy nerve that is in charge of kind of that whole response. And it's called your vagus nerve, which is another kind of thing that's being talked a lot more about. So in Bowen, we have a procedure that kind of influences the vagus nerve. So the second session, I did that on him, and he left then, right? And I think that was the most dramatic
absolutely
difference. You know, he was sleeping, right? And everything from then. And interestingly enough, after he was kind of reset in that sense, he came back, and I repeated a few of the things that I tried on the first and second session that didn't hold, and I did them again. And because he was at a better like state to kind of receive it, he held it a lot better. And then we could start working on certain areas of the body and getting a lot further. I would definitely say. So vagus nerve. And another thing that I think is really important, I don't know if all people do this, but I think people with chronic pain really need to, from whoever they're seeing, has to have good goal setting and be reminded of that. Because when you're in pain for so long, it's like everything sometimes is just like, it's not going to get better. So I like to remind people, and I did this often with you. All right, well, you know, you are getting a little bit of range of motion back. Okay, well, you slept 6 hours now instead of the 3. And, you know, sometimes when you're looking like, I just want to feel better, you know, we kind of forget those small steps are just huge. They're still huge in that respect. So I like to remind people of that they're, no matter what, they're doing a great job. Their body's doing a great job. So you guys should all be reminded on your good days, you know, you're doing awesome, you know. So, and also if they have good support systems. So if I have somebody who's here and we get them all gooey, I have a few people in chronic pain and they go, I know, home to very, very stressful, unhealthy places. And guess what? They hold not well at all compared to the people who are either also going to counseling, going home to a very supportive family that get breaks. So even on the outside of the office, you know, I really try to remind people, you know, I'm not a life coach. Sometimes I do feel like I am. So I try to give my time, you know, give some good pointers where I can. But a lot of it is, you know, anything you do, it's going to hold longer if you can keep that relaxed state outside of, you know, the office as well. So sometimes just looking at what else I can do, you know, besides this. And I do like to give homework. I like to give, again, in chronic pain, movement is key. And I know it hurts sometimes and it's all the time. I mean, I get it. You can do what you can do. But I give stretches. I'm actually going back to become like a special Pilates instructor. I've never done Pilates, but it's like this special myofascial movement. So then it's like I can give just specific exercises for your fascial network. And it's little movements. Your fascia, if it doesn't move, it gets stuck. So the key is, you know, it's so hard. You're in pain and you don't want to move, but it's like, it's so bad because again, your fascia and your brain, it's going to reset and say, oh, this is the new normal. No, you want movement. Fascia should be moving. So that's another really important thing that, you know, we just try to get in there as much as we can. Oh, and one last thing, this is huge. I think you can confirm this. Most of this comes after post-surgery, right?
Yes.
No, a lot.
Yeah.
All right. So interestingly enough, I had this thought today, but so we're talking about fascia. It's connected, right? All this fluid movement. When you have a surgery, one thing that every surgery has in common is you're going to be cut open. What are they cutting through? All of those layers of fascia. So, and what do they do after the surgery? They just sew you right back up. So you had this beautiful form of web of all these cells and matrix of fluid, and then just kind of like rammed back together. So a lot of times, and you can find this anywhere, even if you can't maybe find a Bowen practitioner, is somebody who specializes in scar work. Because the first thing I do, as soon as I try to get somebody out of post-surgery, is work on the scar. Because if you can get those signals into the scar, then you're already telling it, like, you're giving it more of a chance to kind of move and resituate before that scar tissue, really sets in a way that's, not the way it kind of, wanted to be or was meant to be before it was cut open. So I do think I do scar work, I think it's amazing. And I just thought it was interesting because a lot of this comes from post surgery things. So scar work, if you want to try to look into something, I think would be very interesting and, to look into. And I think that's all I have to say, unless I miss something. So thank you very much for listening to us. And I hope it was helpful.
Definitely. All righty. I'm going to come back on. Oh, make sure I have my light turned on. Oh, my goodness. And if you all have any questions, be sure to put them in the chat. I know we have a couple already. And I'm also trying to pin you a little bigger. All right, here we go. Well, Jim, did you have a question to start?
First, I want to say, Emily, good job. And what you're talking
I was really sweating it this week.
and basically, what you're talking about, the vagus nerve stimulation, that is really a hot button right now. And so many people with CRPS talk about the stiffness involved with that. And also the scar work is so important. And I think that the whole shift from the fight or flight to parasympathetic is so important. And what I wanted to say is basically, you're in Massachusetts. People are all over the country. Yeah. I know there's a national organization. Yeah. So tell us about how to get in touch with that. And two, you talked about that even those might not be covered by insurance, it won't break the bank. So talk about that too, please.
Sure. Yes. I'm certified with American Bowen Academy. So if you go to AmericanBowenAcademy.com, there's a whole bunch of information there. And there's a little tab at the top that says find a practitioner. So you can go in there and you can put your zip code in, and it will give you everybody in your area for anybody in the United States. So that's how you can find someone. And yes, most insurance is not covered by insurance. So I can't speak for others, but I mean, my initial appointment is $85, and then every session after that, a full session is $75. Sometimes there is time that I can do something in a less amount of time, like 30 minutes, if there's something a little quicker, I know. So I do have 30-minute follow-ups, and those are $45. So I don't think a lot of people are doing that, but I'm actually closely working with the Academy to kind of get some different ways of getting sessions to people, even clinics. I do clinics a lot because Bowen is great. In the working times, you can work on multiple people while they're resting. So a great way to do it is, have clinics, and then you can charge, less. You have much more going on, but people can kind of still get in there. So I'm actually actively trying to get that kind of out into the world and help people be able to do things like that. So, yeah.
No, I think it's great when you talked about the vagus nerve and the scar work, because when you talk to people who have gone to the Spiro Academy in Arkansas, which is a very treat the whole body clinic, not covered by insurance, that is a lot of their focus too.
Yeah, I think after I learned about scar work, and then actually, I did a lot with Paul. Yeah. And I actually had one woman, and I think it was similar to this chronic pain, but she had 5 different operations in her foot. And each time they went through the same scar. So it was just fascinating there, because then you could almost feel every time I worked on it, it's like you get a little deeper, and then, you felt the scar underneath. And she just, even the next time I would see her, the scar it wouldn't be red anymore. The swelling would be gone. I mean, I'm not going to lie. It took me a long time, even for me, to be like, I don't know how this is doing so much stuff, but people would come back, and now, my confidence can't be shaken. It's definitely doing something. So hopefully with all like scientific stuff coming out, we'll have more studies and such to go on.
So we do have a couple questions in the chat. So I'm going to see how many we can get through. So kind of what you were just talking about, can scar work be done years after surgery?
Yes, for sure. Especially, I'd say, I mean, it's a little bit harder. I mean, fresh scars are the best. But sometimes if people are having a restriction and it's clearly coming from the scar, then absolutely. Then you go in, we do this special. It might be a little bit deeper. It might take, more than once or twice. We just kind of put it in every session. But especially because if you have the fascia in that area and it's truly tugging on it, then if you manipulate the fascia enough, it's going to know it doesn't want to be stuck. So then it's just going to say, oh, sometimes it's just the sensory input you put in that area. It's almost like the brain's like, oh, what's going on there? And so it draws its attention, the nervous system's attention to that area. And absolutely, it can get better. I mean, again, everybody's different. I don't know until I see.
Right, definitely. So Bowen therapy. Any experience with, maybe having success with the therapy if someone has full body CRPS?
I personally have never had somebody that couldn't tolerate being touched. That's all I can kind of say about that. I have had, it seems to me, people who have the full body, you do very minimal. And after the first time, you really got to get to the second time to do the vagus, because doing the vagus work on the first session is a no. You just have to kind of do a little bit of rebalancing before you kind of do something that big. So I just try to get them to the second session where we can do that. But I mean, for somebody who truly can't take anything, I don't know. But I mean, sometimes it's literally like, you can barely touch, right, and still get something out of it.
Okay. Here's a question. Let me see if I can. Do you think beginning in a cast for a long period of time can cause more damage? This person was in one prior to surgery for 4 months and then after surgery for another 6 months.
Yes. Yeah. So they were in a restrictive cast. So what, you get atrophy in your muscles from the cast. You can get swelling. So it can cause a crushing of, the muscles, and that can actually lead to complex regional pain syndrome. Some of the research that I've read about it is that crushing can lead to complex regional pain syndrome. So it's something that if you need to be in it, then you need to, be in it. But to be in that long, that's quite a long time. So I can't see
no movement.
The movement. I mean, the actual, for me, my experience is right now, the more I move, the more I do with my hand and my arm and my shoulder, even though I'm in pain, the next day, if I'm not in more pain, that's a plus for me. So, and then I try to do a little bit more the next day. So as long as I'm not going past a certain level, I'm doing fine. And then the next day, if, after I've done something, then I get a little bit better. So you kind of have to know your limitations, I think.
Our next speaker has a tremendous quote that it's going to be my mantra, and it says, "The fear of movement is the mortar that helps erect the prison of pain."
Ooh.
Right.
And the other thing, Paul, they have taken healthy volunteers and casted them and taken off the cast, and they have their symptoms that mimic CRPS.
Yeah, absolutely. I really think that, you know, them putting a hard cast on my arm actually, you know, aggravated, you know, my complex regional pain syndrome. As it felt like, you know, my arm was just bursting out of the cast because it was swelling so much. They had to take it off, put, you know, another cast on it. So I think if they would have left the soft cast on, you know, I wouldn't have had the same effect. So, and I think being able to move is just a plus for me in my recovery. I think, you know, being able to move. And I think the other thing too is it trains my brain to say, hey, that's okay. You can do that. And I think that's a big part of recovering is being able to, you know, prove to your brain that, you know, what you did is okay and you can do that. And I think that's, you know, when I first, you know, came down with the symptoms, it was like I was frightened to do anything, you know, because I would think, you know, hey, if I do that, then I'm going to be in immense pain the next day. So I had to really condition my brain to say, that's okay, you can do it, you know, and then it's just reinforcing that as you go along, moving more and more. So that, you know, that's exactly, you know, what I experienced.
Paul, were you able to reduce your medication?
I did. That's a great question. They had put me on 900 milligrams of gabapentin, and then I was on Nortrip. I basically, a couple of months ago, tapered off of, well, after about 9 months, I tapered off all of the gabapentin. And I basically only use the gabapentin when I go into what I experience as flare-ups. And I only use one, you know, 100 milligram, usually at bedtime, of the gabapentin. So, and I eliminated the Nortrip altogether. The gabapentin was actually making me way too tired. So I'd wake up tired halfway through the day. I'd want to take a nap. And I'm like, you know, after a while, it was like, I can't do this anymore. So I started to taper off of it. Slowly, you want to slowly taper off of it. So I, you know, reduced it, you know, over time. So great question.
And that's good. That's good news.
Yes, we have another question. I think maybe we'll do maybe one or two more questions. I just lost it. Where did it go? Okay. So this question, can Bowen therapy help with phantom mastectomy pain?
I don't know. It could. I can't really just say what it will and won't help with. I mean, that just wouldn't be fair to either one of us. You know, it's really kind of, we go in, we do assessments. Some people, you know, we're talking about the body awareness. Some people just take to it like this. They're like, whew. And then I'm like, oh, this was easy. And then, you know, some people, it's just like, all right, you know, what are you trying to get at here? And, you know, we got other things to kind of to work with. So, I mean, when I say it, it's very individual. So I don't like to kind of veer off because I don't know until I see, and I don't know until I see.
All right. And then I think this is going to be our last question because we have to get ready for our next speaker. But how is Bowen different from, hope I'm pronouncing this right, myofascial release? I don't know.
No, you said that brilliantly. And you know what? It is pretty much, it is, I think there's different types of myofascial release, but primarily that is what Bowen is. And especially for people with chronic pain, that's what I'm doing. You know, Bowen can also, I spent my first year working at a CrossFit. So I had these big, you know, and that was definitely a different touch that I would use, you know, when somebody came up with, you know, a pulled hamstring or something like that. So you can go a little bit deeper. For people who just can't take the work, it's very light and it's very just, superficial fascia at that. Superficial right under the skin. That's all we're kind of trying to go for and hoping for like a ripple effect.
All righty. Well, thank you so much for this great information. I know I definitely learned a lot. I'm hoping that everyone watching learned a lot about Bowen therapy. And I did put the link to the American Bowen Academy in the chat, so you can check and see if there is someone who can practice Bowen therapy in your area. So definitely be sure to check that out. Once again, thank you both for joining us and educating all of us.